All right, thank you so much for that introduction. Yes, I'm at the University of Virginia, like Connie said. I'm a student, so in the lab I've been working on focused ultrasound as a way that we can hopefully treat cerebral cavernous malformations in mouse models of the disease. And I'm really thankful for this opportunity to talk to you all today, just more broadly about focused ultrasound and how it works, and then also specifically about how we're hopefully going to use this as an approach to treat cerebral cavernous malformations non-invasively. So for this talk, I have it broken up into two sections. The first section being what is focused ultrasound? So some background information. We'll talk about how this technology works, as well as the different disorders that are currently being treated with focused ultrasound. And then in the second part, we'll talk about how focused ultrasound is being used to treat cavernomas in the laboratory setting. And so we'll talk about two different flavors of focused ultrasound, the first being temporary and reversible blood-brain barrier opening as a strategy to help increase drug delivery specifically to the cavernoma. And we'll also talk about sonodynamic therapy as an approach to hopefully kill or cause cell death specifically within the cavernoma. And so I just want to start off with this definition of focused ultrasound that's been provided by the Focused Ultrasound Foundation. So focused ultrasound is a rapidly evolving, non-invasive therapeutic technology that has the potential to transform the treatment of many different medical disorders. And it does this by using ultrasound energy to target tissue deep within the body. And it does all of this without any incisions or radiation. And so focused ultrasound therapy combines the use of two different technologies. One being focused ultrasound itself, which is a way of saying a concentrated form of ultrasound as a way to provide sound energy deep within the tissue so that we can treat deeply in the body precisely and non-invasively. The second is imaging guidance, and we typically think about magnetic resonance imaging, or MRI, as a way to identify the target tissue, as well as to confirm the effectiveness of treatment with focused ultrasound. And so many of you probably have never heard of focused ultrasound before, and that was the case for me as well when I started out in the lab, so that's not unusual. But you probably are familiar with diagnostic ultrasound, which is commonly used for pregnancies or monitoring pregnancies to provide images of the baby. With focused ultrasound, it's really similar. We're just taking these ultrasound waves and concentrating them into a small volume where we can then produce a wide variety of mechanical or thermal effects for therapeutic purposes. And so I like to have this analogy of thinking about when you're a child and you hold up a magnifying glass to the sun, and that's a way to concentrate the sunbeams into a really small volume where you can actually heat up tissue, or heat up the leaf. With focused ultrasound, it's the same strategy. We're taking these ultrasound beams now and concentrating them into a very small volume where you can then heat up tissue or cause mechanical effects to the tissue. And so I want to talk about how focused ultrasound works a little bit more deeply. So this is just a reminder that sound waves are essentially pressure waves, and that means that we're essentially, throughout the sound wave, oscillating between a state of low and high pressure over time. And so with focused ultrasound, we can manipulate these pressure waves into a variety of different forms, and that's how we can produce all these different mechanical and thermal effects. So if we look at this figure on the left, you can see that in some of these regions we're just doing very short periods of focused ultrasound, so we're turning it on and off again. But there's also instances where we're leaving the focused ultrasound on. And so all of these different strategies can really affect the type of mechanical or thermal effect that we produce. And to walk through this a little bit more deeply, if we look first at this yellow wave form, here we're applying a very high pressure. So pressure is right here on the y-axis, the left axis. So here we're applying a high pressure over a short period of time, and that allows us to produce up to 9 biological effects, and one of those can be breaking up blood clots. If we look at, this should be a teal color, so this teal waveform, Here we're applying moderate pressures over, again, a short period of time, and here we can produce 12 different biological effects, one of which is activating the immune system. In blue, we are applying really low pressures over a short period of time, and that can produce over 27 biological effects, one being drug delivery. And then finally, with this purple wave, we're applying sound waves continuously, and that can allow us to produce 10 different biological effects, one of which being heating up the tissue enough to heat up a tumor and destroy those tumor cells. Yeah, it can be very different depending on the application. So in some cases, the goal really is to increase immune cells or white blood cells to the tumor. This is often used for tumors. So it's a way of, yes, hopefully getting your immune cells into the tumor to recognize that tumor and help your body fight that tumor. Yeah, good question. And so all of these different waveforms or mechanical and biological effects that are being produced with focused ultrasound is why it's such a versatile treatment option to treating many different diseases. And so hopefully on this figure on the left, you can kind of see that we're using this approach to treat a wide variety of different disorders. And those range from women's health issues to abdominal disorders, as well as neurological diseases, and many more. And with all of these different disorders that are being explored with focused ultrasound, we're at very different stages of development of this technology for these disorders. So those can range from very early stages of development, like the conceptual and preclinical stages, which is the case for brain metastases of melanoma cancer, all the way up to FDA approval and insurance reimbursement, which is the case for bone metastases. And this is just a very short list of the different disorders that are being treated currently with focused ultrasound. We are actually exploring over 150 different disorders with focused ultrasound as of last year. And that's the broader field, definitely not our lab. So far, we've had patients undergo more than 467,000 treatments with focused ultrasound. The large majority of these have been focused on tumor treatment, but there has been a rise in people that are being treated with brain disorders. So those include essential tremor, which is now FDA approved and has insurance reimbursement. And it also includes patients with Alzheimer's disease and Parkinson's disease, although those are more in the clinical trial phases currently for the most part. Okay, so with all of that background information in mind, I'm going to shift gears now and actually talk about how we're using focused ultrasound in the laboratory setting to treat cavernomas. So, as I'm sure everyone in this audience is more than aware, the current standard of treatment for CCM is surgical resection of the cavernoma. And of course, that can be presenting risk to the patient, and it doesn't address lesions that are not operable due to their location within vital brain tissue. So that really motivates for us the need for non-invasive approaches to treat CCM. And with focused ultrasound, we can do that by specifically targeting cavernomas, as well as targeting cavernomas deep within the brain tissue. And so currently, we are still in the early phases of cavernoma treatment with focused ultrasound. Specifically, we're in the preclinical stages, meaning that everything is still being done in the laboratory setting with animal models, and humans have not been treated in any way yet for this indication. And so at the University of Virginia, we are looking at two different non-thermal biological effects. And the first is blood-brain barrier opening as a temporary opening strategy to enhance delivery to the cavernoma specifically. And the second is sonodynamic therapy as a way to cause specific cell death within the cavernoma. And so we'll start first by looking at blood-brain barrier opening. And before we talk about opening the blood-brain barrier, I think it's just a good idea to get on the same page about what is the blood-brain barrier. And so we have here on the left a brain, and there's many blood vessels within the brain. And so here on the right, we're just going to look at one of these blood vessels within the brain. So the blood vessels in the brain are actually pretty unique compared to your blood vessels within the rest of the body. And that's because these cells that make up the blood vessel wall are really good at preventing things within the blood from crossing into the brain tissue. And so the blood vessel walls, or the cells of the blood vessel wall, only let very, very small molecules across, or things that the brain needs to survive, like oxygen and sugar, which will make special transporters for specifically. And so this can be really challenging when we need to treat different disorders of the brain, because we might have a really effective drug, but it's not able to cross into the brain tissue very well. And so in these cases, it can be helpful to open the blood-brain barrier temporarily to let these drugs cross into the brain tissue. And so to explain more specifically how we can use focused ultrasound to perform blood-brain barrier opening, I just want to remind you again that sound waves are really pressure waves. And so with this approach, we take advantage of how these pressure waves affect these things called microbubbles. So microbubbles are very, very, very small gas-filled microbubbles. And they were originally used as a way to cause contrast with ultrasound imaging. And so at high pressures, here we go, high pressures, the gas within these microbubbles will compress, and that causes the microbubbles to shrink in size. At low pressures, the gas within these microbubbles will expand, and that causes the microbubbles to grow in size. So throughout the duration of the ultrasound exposure, the microbubbles will oscillate between large and smaller sizes throughout this entire sound wave duration, wherever the microbubbles are encountering the ultrasound waves. And to look at this more specifically within the body, we're again going to look at one particular blood vessel within the brain. And so we start by injecting our microbubbles into the bloodstream. And then we'll apply focused ultrasound specifically to where we want to target within the brain. And so focused ultrasound is very precise. As I mentioned earlier, it has a resolution of about 1 millimeter. And so that lets us to target very specifically, especially within the human brain. So here we would be targeting specifically the cavernoma. So now wherever the, oh yeah, yeah, it's like an IV, yeah. No, it's just an IV, exactly. Yep. And so wherever these microbubbles will encounter the ultrasound waves, they'll begin to oscillate. And this will cause pushing and pulling on the cells that make up the blood vessel wall. And that causes a temporary disruption of the blood-brain barrier. So now if we were to inject a drug into the bloodstream, it can cross much more easily across this blood-brain barrier and accumulate specifically where we targeted within the focused ultrasound path. And I really want to emphasize that this is a temporary and reversible effect. So by 4 to 6 hours after focused ultrasound sonication, the blood-brain barrier closes again, and we expect that there's a complete closure by 24 hours with the next day following focused ultrasound sonication. And so you might be wondering, why do we want to use this for cavernomas? And that's a great question. So hopefully you've already seen somewhat today, but you'll probably see throughout this conference that there's a lot of already promising pharmacological or drug candidates that are available for cavernoma. And this strategy can really help us to enhance the concentration of the drug that gets to the cavernoma. And that can be helpful for just essentially altering the dose that gets to the cavernoma rather than the rest of the body, which can help us reduce side effects as well as increase tolerance of that drug for people. It can also help us unlock delivery for larger molecules, and we'll talk specifically about antibodies and gene therapies as options. And so antibodies and gene therapies typically are not being investigated very much due to the large size of these molecules, which really make it hard to deliver them within the brain. And I have on the left this table, and I don't want you to look at it too closely. I really just want to indicate this one column of the table that shows the current drug candidates that are being investigated for cavernomas. And in this table, most of these molecules are very small molecules. And so that really highlights the the importance of focused ultrasound as a way to increase or unlock new classes of drugs for cavernomas. So hopefully by using focused ultrasound blood-brain barrier opening, we can expand the current drug options to be more than just small molecules, and to expand those into things like antibodies and gene therapies that are larger and make those more feasible options for cavernomas. And so to show some of the data that we've been, and the research that we're doing within the lab at UVA, I have here our focused ultrasound parameters. So we essentially are, in this study, trying to understand if the focused ultrasound blood-brain barrier opening is safe within our mice. So we treated our mice 3 different times with focused ultrasound, and we staged those 3 different days apart. So 3 days separations between each of these treatments. And I really want to emphasize here, we did not deliver anything therapeutic alongside this treatment. We just wanted to understand if repeat blood-brain barrier opening would be safe within cavernomas. And so we performed this study by first taking pre-images of our cavernomas, which this is what it looks like within the mouse. And then we took follow-up MRI images after each focused ultrasound sonication, as well as up to 1 month after sonication. And hopefully from these MRI images, you can appreciate that the cavernoma that we targeted, which is circled here, does not change in size over this time. And so to us, that indicates that we did not cause any negative outcomes by opening the blood-brain barrier in our mouse model with cavernoma. And so next, we wanted to look at whether or not we could make this an effective approach for cavernomas. So we looked at delivering a small molecule called gadolinium. Gadolinium is an MRI contrast agent, meaning that it will appear as this bright white signal on T1-weighted MRI images. And this is a way to basically look at small molecule delivery. But gadolinium does not cross the blood-brain barrier on its own, but hopefully after successful focused ultrasound blood-brain barrier opening, we will get it across the barrier and it can accumulate. So here in this first image right here, we have our baseline image of the cavernoma that we targeted with focused ultrasound. And then in the middle image, we have right before we treated with focused ultrasound. But we already injected gadolinium, the small molecule, at this time point, and you can see that it has not absorbed into the brain because the brain remains dark. And then we have on this right, or this last image, our post-sonication image, and hopefully you can appreciate that after blood-brain barrier opening with focused ultrasound, we do get an increase of the gadolinium small molecule around the cavernoma, indicating that we are able to enhance small molecule delivery with focused ultrasound blood-brain barrier opening around the cavernoma. And so that wraps us up for, or I should say too, that our next steps for this project is to start delivering therapeutic molecules now that we have an understanding of the safety and effectiveness of this approach. And so with that in mind, we're going to shift gears into sonodynamic therapy as another non-thermal approach for focused ultrasound within cavernoma treatment. And so sonodynamic therapy has been an approach that's been really popular lately for causing cell death within tumors, cancer. And we would like to adopt this approach as a potential way to cause specific cell death within cavernoma cells. So this approach works by taking a molecule that is sensitive to sound, called a sonosensitizer, injecting it again into the bloodstream. And this molecule is so small that it can cross the blood-brain barrier on its own, and it can bind specifically to the cavernoma. After the sonosensitizer has been absorbed by the cavernoma, we'll activate that molecule with focused ultrasound, and that causes the activated sonosensitizer to release a harmful substance specifically within the cavernoma. After the sonosensitizer is activated, that harmful substance should cause cell death specifically within the cavernoma. And so with this approach, the idea here is that we are injecting a molecule that on its own is not harmful, But when we activate it with focused ultrasound, we can cause very specific cell death within specifically the cavernoma. And currently there's been, or this was last year, there's been a potential sonosensitizer known as tazolurstide that's been found to bind to cavernomas within patients. And so in this left image, we have the cavernoma. In the middle, we have the sonosensitizer called tazolurstide, and it's a green color here. And then this right image is the overlay of the two images on the left. And hopefully you can see that the tazolurstide, the sonosensitizer molecule, is binding specifically to the cavernoma and not to the rest of the brain tissue, which indicates to us that that could be a very good option for sonodynamic therapy because it's very specific to the cavernoma. Before we could test this molecule as a sonosensitizer for sonodynamic therapy, we first needed to understand and make sure that this sonosensitizer would bind within the cavernomas in our mouse model of the disease. So again, we have tazolurstide here in green, and we did indeed find that within these different mouse brains, we see overlap of tazolurstide within our cavernomas. And so our next steps now are to actually apply focused ultrasound to this molecule within our mouse model and see if we can cause specific cell death within the cavernoma. And so thank you so much for listening to me for this long. I'm just going to wrap up here really quickly, first with a summary on the background information. So focused ultrasound is a non-invasive technology that can treat many different disorders without any incisions or radiation. Changing the ultrasound wave allows us to cause many different biological effects. And this variety of biological effects is part of the reason why focused ultrasound is being explored for more than 150 disorders. And so far, patients have already undergone more than 467 treatments. And to wrap up the focused ultrasound for cavernoma section, focused ultrasound is still in the preclinical stage for cavernoma treatment. We at the University of Virginia are exploring two non-thermal forms of focused ultrasound, the first being temporary blood-brain barrier opening to help us enhance the ability for drugs to reach the cavernoma. And the last approach being sonodynamic therapy as a way to cause specific cell death within the cavernoma. And so going forward, we're planning to begin to test the blood-brain barrier opening approach with various therapeutics in our mouse model, and in parallel, test the sonodynamic therapy with tazolurstide, again within our mouse models. And so right now, we're still in the preclinical stages with cavernoma treatment, but hopefully with more time and energy invested into this technology and approach, we can move that dial to FDA approval and US reimbursement status so that it's an available and non-invasive approach for patients. And sorry, I just want to throw this up really quickly. This has been a very collaborative project, so I have my lab here on the left, as well as our collaborators, Peter Tverdik and Khadija Sharifi, who are here today, so you can also ask them questions, and they did a lot of the work on sonodynamic therapy, as well as Wilson Miller. And if any of this was really interesting to you today, I also want you to know that there's an organization called the Focused Ultrasound Foundation, and I have their website listed here, fusfoundation.org. And they have a lot of great resources. I stole a lot of their resources for this presentation today, but I highly encourage you to check that out as well. All right, now I'm done.
Got it. Thank you, Delaney. That was wonderful. All right, now I know you guys have questions. How many hands can I see up at the same time? All right, we'll start and go around again.
And we have a lot of time. Thank you. So I just want to make sure that I understand too. Is the objective to use ultrasound as a way to open up to get to cross the blood-brain barrier, but the treatment would be more the medicine that you're getting in, and then the ultrasound just directs it, like navigates it? Is that what's happening?
Yeah, so that is our hypothesis, is that we would need to still deliver a therapeutic into or around the cavernoma, and that this is really just a way to help get that drug better into the cavernoma. We are also going to explore just if blood-brain barrier opening on its own could be helpful, but we don't know yet if blood-brain barrier opening itself might be a helpful approach on its own without drug delivery.
So the ultrasound, the sound waves in themselves are not therapeutic alone?
We don't know yet. So it really depends on the disease that it's being applied to. So we do know in Alzheimer's disease that blood-brain barrier opening on its own can be helpful, and that is the hypothesis there is that you're helping to allow those plaques that are one of the main causes of Alzheimer's disease to better get out and leave the brain tissue. We don't know if with cavernoma if that might be helpful to kind of help get some of the clot out, but it's a possibility and we're going to look into it. It's a great question. Thank you.
I had a couple questions. One, how long do you focus the wave on?
Yeah, it's a great question.
And the second thing is, I think the human skull is a little thicker than the mouse skull, so does that change the parameters about how you deliver the ultrasound?
Yeah. Great insights. Yes, so our approach causes, or we only apply focused ultrasound for 2 minutes, so it's pretty short for focused ultrasound duration. The setup takes a while for both mice and humans, so while the application on its own might be short, setting up the MRI and all of these things can take longer. With humans, you're absolutely right. The skull is much thicker in humans than in mice, and we actually have a completely different setup between mice and humans. So I talked a little bit about at the very beginning, the thing that creates the ultrasound waves is called a transducer, and in mice, we basically just curve the transducer, and that allows us to concentrate it into a small volume, very much like a magnifying glass. In humans, the setup is different. You actually have this kind of helmet where there's many different transducers throughout the helmet, and that allows you to disperse the ultrasound around the skull, so you're not just heating up or putting all the energy into one spot of the skull, and that is very helpful for distributing that energy and not causing any heating or other non-desired effects.
Kevin wants one more question.
There's surgeons that'll make a window in the skull, and so it's an lucent skull, so you can deliver it. I mean, it's probably maybe for like a cancer or something might be appropriate, but I mean, are you guys doing that too?
So we don't do that. The whole idea here with focused ultrasound is that you don't have to do any incisions into the skull. So that's really, the move is that you might still need to shave the heads. We do that for the mice as well, but in terms of causing any removal of the skull or causing any incisions, we're not doing any of that. No.
Other questions? I saw plenty of hands.
I know there's a lot of factors that go into this, but do you have any idea if things did go well, the time frame for which it would take to get from the preclinical to the FDA approval?
Yeah, it's a good question. I don't really know. Right now, we're one of the only labs that are looking into this. I think it would definitely help if we had more, people on the project. We are in a good spot, though. We at UVA are both a center of excellence for both CCM and focused ultrasound, so it's a really good spot to be moving this technology along. I don't have a specific timeline for you, though. I'm sorry.
A lot of it depends on funding, and we've sent some money their way in order to keep this project going so that they can collect the data that they need in order to ask for larger funding. Multiple years. Yeah. Others? Okay, I'm going to come around here first.
Hi, this all sounds wonderful, and I think about all the people, all the patients, the CM patients who are in like smaller communities or they don't have one of the top neurosurgeons that are really well connected, and finding about this new type of treatment and its availability. How do you kind of get the word out so that the regular humans who have this find out about this type of treatment? Because usually you're just faced with whatever proposed treatments your doctor has for you, but there's so many new things on the market, and I feel like we're getting special information here, and so we can connect with you, but how does that get out to the regular public?
Yeah, that's a very good point. Luckily, I don't have that job on my hands, but that is the true mission of the Focused Ultrasound Foundation, is to inform both patients about the technology as well as clinicians and researchers, so that we can, very much like the Alliance Secure, connect people about this technology. It's going to take time, and I think we're growing right now, but it will take time, I think, in popularity of this technology being used for the other disorders as well to make it known. So hopefully it does get more popular, but the Focused Ultrasound Foundation, that's really their mission, is to help expose this technology to people.
Okay, I'm going to step in and give more answer to that.
Sure.
So the Focused Ultrasound Foundation was founded by Dr. Neil Cassell, who was a cerebral vascular neurosurgeon at UVA. He founded it specifically, this is what he shared with me, because of his frustration with CCM treatment. Now, as Delaney has shown you, there's been 100 other diseases that they've been able to tackle before CCM because they're easier. Ours is a little bit harder. They needed to know a little bit more before they could go after it. One of Neil's best friends is John Grisham, and there's this book that you can go on Amazon and get called The Tumor that he wrote, that John Grisham, you know who he is, right? Like the very, very popular novelist, that he wrote and is giving away for free. So they have some so that people can learn about focused ultrasound. And it's a novel. You can go look for it on Amazon and you can just download it and read it. So they have novel ways of helping get the word out. Now that you are aware of the words focused ultrasound, if you Google it, you will come up with, especially in Google News, you'll come up with dozens of stories that they've been able to get planted into the popular press about its use in different facilities and for different disorders. So, yes. And you know what? We'll tell people when it's available for our patients. Questions before I move up to the front of the room?
Hi, I have a two-part question. Okay. The first is, if you have a growing angioma that is leaky, how does that affect removing it, with the focused ultrasound? So I don't know if you want to answer that.
Sure, yeah. I'll do that, yeah, thank you. So we don't entirely know for sure how the different leakinesses will affect focused ultrasound treatment, and that is certainly one of our goals with the preclinical studies and mouse models. We did do a separate study in our mouse model that looked at the leakiness of all the different lesions. So we do have ways to use MRI to understand how leaky a specific lesion is. And so hopefully we can correlate whether it matters or not if a lesion is leaky already or how that will affect it. I think does that answer?
Yeah, if the lesion is growing, though, does that have any effect and it's leaking at the same time?
I don't think that the growth will affect it. That's my hypothesis, but again, we'll look at the data to see if that's correct. We started out treating much smaller lesions just because we didn't know at all how this technology would affect the cavernomas, but we've started moving into treating larger cavernomas in our mouse model, and so far it looks just as safe as it was for the smaller lesions.
Oh, yep. That's good. My other question is, if your angioma is connected to your arteries and it becomes AVM, can you still use this type of treatment?
I think so. My specialty is definitely not in AVM, so I don't know the answer to that, but I think it would be okay.
I think she meant DVA.
Or DVA, but again, also don't have a specialty in DVA. But I think it should still be appropriate. But again, we'll probably have to test that first to see. Yeah. Thank you for your questions.
Other questions?
I'm really fascinated with the accuracy that you mentioned, 1 millimeter. Do you know what the smallest target you've had to target would be about?
Me specifically, or kind of the field in general? Yeah. So when patients are being treated for things like essential tremor, and it sounds like maybe this was alluded to in an earlier session, they're using a heating approach, and in those cases the goal is to basically disrupt the circuits in the brain that are not functioning correctly, and those targets are very small. I'm not entirely sure how small it is, but they will use like the lowest end, so around 1 millimeter. Yeah. Yep. Thank you.
I had a question about the sonodynamic therapy. So if it's supposed to kill the cavernoma cells, could it also kill the hemosiderin ring, or is it just the cavernoma itself?
Yeah, so the hemosiderin ring is not living, I guess. So your cells within the cavernoma, or for the most part, the cells around there are living small organisms, if you want to think about it that way. The hemosiderin is not in any way alive, so it probably won't impact that. So it would really just be killing things that have a metabolic activity, so like your cells specifically within the cavernoma. Yeah, good question.
Okay, you're on question 4.
This is going to be in a different way since you're a grad student and doing this, and these studies take a while. I would imagine you're hoping to graduate before the study's through.
That's a good observation.
There's a lot of scientists here. How do you stay on this research?
Yeah.
And how do, you see this team, and I grant you some will change.
Yeah.
But I would imagine you get dedicated to some of these things.
Yeah. Wow, that's a great observation. Yeah, so my advisor is standing in the back over here, so he will ensure that this project lives on as, even when I graduate. But I'm also interested in going forward in research, and there's still the possibility that I might also want to continue on these research in a lab of my own as well. So, yeah.
All right, you can have a question.
You made a point of thermal versus non-thermal, and so I guess other people are doing research in thermal in your lab too. And the other question, your N is like in hundreds of thousands. So is that each patient can one patient on one day have several different procedures done, or and how many are they come back for more procedures? Or,
yeah, great question. So yes, there are students in our lab that work on thermal technology, but that tends to be outside of the brain. It can be difficult to heat up tissue within the brain, not that it's not being done, but it's not something that we've really done much in our lab, specifically in the brain. Patients do get multiple treatments. That can be either if you are trying to kill cells within a tumor, you might do multiple treatments along that tumor. People come back for repeat treatments as well, so that can kind of affect the numbers.
So one patient might have how many, might represent how many?
Yeah, it depends on the disorder. So there are certainly patients that are only getting one treatment and that is all. But it really just depends on, where this element is in the body and the type of thing that is appropriate for that.
Any other questions? All right. We are, again, a little bit ahead of schedule. Delaney, thank you.
Thank you guys
I
so
just
much.
stopped and whispered in Dr. Price's ear, she's so impressive. And I do hope that you do continue in the field for a long, long time. Thank you.